Diarrhea. Diarrhea. This term is used to refer to the product of bowel work, i.e. stools that are watery and loose. This phenomenon is very common, but it does not pose a threat to life. Most people suffer from diarrhea at a rate of 1 or 2 times during 1 year. In most cases, diarrhea lasts for 2 or 3 days, and diarrhea is generally treated with over-the-counter medications. There are people who suffer from diarrhea caused by irritable bowel syndrome or as a result of another group of chronic intestinal diseases. Various cases of diarrhea. Doctors usually divide cases of diarrhea into 3 groups. Osmotic diarrhea. It means that there is a factor that attracts fluids from the body into the intestines. A common example of this is diarrhea resulting from eating diet sweets or chewing gum that contains sugar substitutes such as sorbitol, which is not absorbed by the body and causes the body to secrete fluids into the intestines, so the result is diarrhea. Secretory diarrhea. It occurs when the body secretes fluids into the intestines without the need for it. There are many types of infections, medications and various diseases that can cause this type of diarrhea. Exudative diarrhea. It occurs when there is blood and pus in the stool. This type of diarrhea appears in patients with inflammatory intestinal diseases such as Crohn's disease or ulcerative colitis and in various intestinal infections. Diarrhea symptoms. The symptoms associated with diarrhea can be divided into 2 parts, mild diarrhea and acute diarrhea. The appearance of acute diarrhea may be an indication and evidence of another, more severe. Symptoms of acute diarrhea can include flatulence in the abdominal cavity or intestinal cramps, loose stools, watery stools, urgent feeling of bowel action, nausea and vomiting. In addition to the above, the symptoms of acute diarrhea may also include the following side effects and effects. The presence of blood, saliva or food that has not been properly digested in the stool. Weight loss. Fever. Causes and risk factors for diarrhea. The most common cause of diarrhea is a virus that infects the intestines. This inflammation generally clears up on its own after 2 or 3 days and is sometimes called the gut flu, stomach flu or gastroenteritis. The causes of diarrhea may be due to an infection caused by a germ, which is the main cause of most cases of food poisoning. Infections caused by other organisms. Eating foods that irritate the digestive system. Sensitivity to certain types of food. Some medicine. Radiation treatments. Intestinal diseases such as Crohn's disease or ulcerative colitis. Intestinal failure, when the body is unable to absorb certain foods effectively. Hyperthyroidism. Certain types of cancer. Misuse of some substances that cause diarrhea. Gastrointestinal surgeries. Diabetes. Diarrhea can also occur following constipation, especially in people who suffer from irritable bowel syndrome, which is one of the important causes of diarrhea to know. Complications of diarrhea. Continuous diarrhea causes the loss of large amounts of fluids and nutrients necessary for the body. If a person suffers from loose and watery stools more than 3 times a day and does not drink enough fluids, he may become dehydrated, which leads to severe complications that pose a threat to life, if not it is processed as it should. The attending physician should be informed in the event of persistent diarrhea accompanied by any of the following signs and symptoms. Dark-colored urine. Small amounts of urine coming out when urinating. Tachycardia. A headache. Dryness of the skin. Feeling restless. Confusion. Diarrhea in children. Diarrhea in children that has led to dehydration may be accompanied by one or more of the following signs and symptoms. Dry mouth or tongue. 2 eyes or 2 sunken cheeks. Interruption or decrease in the amount of tears. Decrease in the amount of wet diapers. Restlessness or apathy. The skin remains wrinkled after pinching it instead of returning to its normal smoothness. Diagnosis of diarrhea. Blood test. A complete blood count test can help determine the cause of your diarrhea. Stool test. Your doctor may recommend that you test your stool to see if bacteria or parasites are causing your diarrhea. Flexible sigmoidoscopy or colonoscopy. Diarrhea treatment. Treating or reducing diarrhea. When someone has mild to moderate diarrhea, they can wait for it to go away on their own and not try to treat the diarrhea by other means, or the diarrhea can be treated with over-the-counter medications. Pharmacotherapy. It includes treatment that can be obtained in liquid form or tablets, and it is important to read the instructions attached to the medicine box, as the medicines include the following: Pepto-Bismol, Imodium A, D, Kaopectate. Tips for treating diarrhea. You should drink at least 6 250 milliliter glasses of liquid a day. You can drink juice that does not contain pieces of fruit pulp, soft drinks without caffeine, chicken soup without fat, tea with honey and energy drinks. Instead of having drinks with food, get into the habit of drinking them between meals. Drink small amounts of fluids on a consistent daily basis. Diarrhea prevention. Key measures to prevent diarrhea include: access to clean drinking water, hand washing with soap, breastfeeding for the first 6 months of an infant's life, good personal and dietary hygiene, health education about how infection is spread. Thanks for watching.